All right, so we know that for many people right now, time is ticking because we're talking about Medicare enrollment again. It's going on now through December 7th. So you say, well, you know, time's not really ticking that fast, but when you're talking about so many different choices out there, it can really be what's known as the Medicare maze, and I think a lot of people struggle with this. So today, hopefully, we're going to give you some clarity if you're going through this or if you have a loved one who's going through this, because I think all of us in our families do have someone. Carl Burball from the Senior Source is with us now to offer some help with signing up. You come just in time. I'm sure that there are a lot of people out there right now who are turning the volume up on this. So thanks for being here. Let me ask you this first off. You know, when you hear of someone in your family, maybe it's your grandparent, maybe it's your parent, and they're saying to you, like, I'm trying to figure out which plan to go with, and you think, well, how many plans are there? How many plans are there that people have to choose from, first off?
So if we're talking about medical or Medicare Advantage during this time, there's like 65 in the Dallas market. And then if you're just looking for a prescription drug plan to go with Medicare Part A and B, there's about 25 of those. So a lot of different options to choose from.
That is a lot. And then you have that jigsaw puzzle effect where you're trying to pick, you know, different plans for different things. And then there's something called Medigap. What is that for people who don't know?
So Medigap, it's private insurance. It's a secondary to Part A and Part B for medical. So it covers the costs like co-pays, deductibles, and co-insurance, which Medicare Part A and B does not always cover. So yes.
When someone is starting out in this, and I know you all were here with us a couple of weeks ago to talk about this in a phone bank, and we had people calling in with their questions. First of all, what is the most typical question that you all get when people are calling in?
Well, I'll tell you this, of all the calls that we fielded last month, I don't think one was exactly the same. I mean, everybody, again, comes to the table with a different situation. I think a lot of it is, I have other insurance, like I'm still working, but I want to work past 65. What do I do? Do I have to sign up for Medicare? Can I compare it to my current insurance? So it's a lot of it is what else do they have going on in their situation? So that's a big
And every
part of
now and then, or probably more than every now and then, you get someone asking, which one's the best plan for me? Like, just tell me which plan is the best one.
Sure.
And that's a tough one because that varies by person and by their needs.
Exactly, and I think what we try to do is put it back to them and say, okay, well, let me ask you a couple questions. Tell me about your doctors. The plan that you're considering, are your doctors included in that plan? Are your prescription drugs going to be covered under that plan?
So this is the blueprint here. So if someone is starting out in this process, or if someone in your family is struggling with this process and is needing some help from you, these are the things that you sort of line up first. Like, okay, let's identify the doctors that you have or would like to have. Let's check some individual plans, or check with these doctors' offices to make sure that they are that they cover or that they take that coverage this year and next year, because you're choosing for next year.
Correct. Exactly.
And then where do you go from there? If you're looking for a site where you can compare different plans after you've narrowed it down a little bit.
Yeah, so the Medicare website is medicare.gov. It's really it's got a program called Plan Finder. You can go there and put in your zip code, put in your prescription drugs. You can put in your the pharmacies that you go to and use, and then it will take you right to a place that sorts all the plans, and it'll show you the numbers, the monthly premium, what your expected co-pays are, like to see your doctors, your specialists, and then like what your co-pays would be to get your prescriptions filled.
And right now, if you're on another plan, you should know, those numbers, what a copay costs you, what your monthly premium is, so that you can compare and contrast with, what you're paying right now. What if a person, let's say, is 65 or they're about to turn 65 and they have other insurance? Can you speak to that?
Sure. So I think the question is, how long do you plan to continue to work? Because many people are still working past 65 these days because we're living longer, and we just need a way to continue to sustain our way of living. But so I think it's if they want to continue to work and have that other insurance, they can choose to delay Medicare. Because Medicare is always going to be secondary if you're working and you have employer insurance. That's going to be your primary.
So that'll pick up first. Okay, good to know that. We see a lot of ads, and we were talking about this during the break, for Medicare Advantage. There's a lot of different plans under that. What is that, and how is it different from just having Medicare?
Well, so it's private insurance, so it's going to be one of the many private health insurance companies. It's not going to be Medicare or the government picking up the cost. And so it covers medical, it covers prescription, but it's also going to cover other things like dental, vision, hearing, and fitness. Those are things that original Medicare does not cover.
Okay. Now, let's say if a person misses enrolling into Medicare when they turn 65, can they do it now during this enrollment period?
So the answer is no. They would have to first go through Social Security to enroll, Part A and Part B. And then at that point, they would probably have to, and they could do that during January 1st through March 31st if they missed their initial enrollment period around their 65th birthday. Then they would probably have to wait till next year during this time, the annual enrollment period.
Okay, so each one of these answers really is helpful and gives a lot of clarity for what is, I think, a very opaque process for a lot of people. But I could sit here for 30 more minutes and keep asking more questions and still not get to all the questions that people have. You all have another in-person event coming up, and these are a big deal because, you know, people can get more of those individual answers as well. Tell us a little bit about that.
Absolutely. So during this Medicare time, we've been conducting in-person seminars with the option of sitting with a counselor one-on-one. So Thursday, November 30th, 10 o'clock at the Senior Source location, 3910 Harry Hines Boulevard, we'll be conducting an in-person seminar. We'll provide general information about Medicare, about enrollment, about the different plans. Then at that point, if they so choose, they can sit down with one of our expert counselors, sit down and talk about their situation.
So there you see it right there, Thursday, November 30th, starting at 10 a.m., goes to 11:30 a.m. I was going to put you through to p.m. That would be a long day.
We could be there that long. It could
you
be.
probably could. Senior Source, 3910 Harry Hines Boulevard. If you're coming down south on the tollway, you know, right there before it splits off to 35, you can look over and actually see their building there. So that's where it's located. Last thing for you, I think a lot of people, when they hear about these kinds of events, they think, oh no, is this going to be people who are, you know, paid something? Do they get a kickback for steering me to a particular plan? You guys are very upfront about, you know, making sure that people know, in this case, that you don't.
Absolutely, because we're a nonprofit, we're completely unbiased. We don't represent companies, products, anything like that. We just want to meet the specific needs of the client. That's our number one objective.
That's very refreshing too, because people are able to get those honest answers and what is a, you know, again, sometimes a confusing process.
Yes.
Carl Burball with the Senior Source Center, really appreciate you coming on and for all that you guys do.
Thank you for the opportunity.